Hi friends, today we are going to be talking about a very important topic, chelation therapy. So how does it affect the eye, the brain, the heart and the other organs? This is what we're going to be talking, and this is in colloquial terms called wellness cocktail. So we have different types of cocktails, mocktails, which we are commonly drinking. Now, wellness cocktail for therapeutic uses are in vogue now, and we are doing it for our patients who have low vision, for retinitis pigmentosa, macular degeneration, heart conditions, diabetic complications, people who have lead poisoning, mercury poisoning. These were started initially for that condition, but they also found for people who have who took these the poisoning, people who had heart conditions also improved. So that's when they started doing a study called the TACT trial, TACT trial, and they included at least over 2,000 patients, and in that study they found significant improvement in people who had chelation or vis-a-vis without. So that's when chelation came to vogue, and it was a multicentric trial. And this also in genetic eye diseases, I went into a PubMed search and found, because this is mostly a vascular problem, the retinitis pigmentosa, macular degeneration, macular dystrophies, and the stroke in the eye or optic nerve damage, glaucoma, all are microvasculopathy. So if the heart can improve, why not the eye? So that's when I went deeper into search, and I found that yes, it does have improvement with chelation therapy. So the mechanism action of wellness cocktails, the typical ingredients are magnesium, which is neuroprotective and vasodilatory, vitamin C, vitamin B complex, antioxidants, mitochondrial support this vitamins are giving. Heparin on a low dose improves microcirculation and perfusion. DMSO, it is an anti-inflammatory, membrane penetrating antioxidant. Sodium bicarbonate, it's pH buffer and may aid in metabolic acidosis. EDTA in chelation removes heavy metals, may reduce vascular calcification, and thereby the potential benefits in eye conditions are the in retinitis pigmentosa, the oxidative damage to photoreceptors are reduced, but it is definitely supportive, and it is definitely not a cure. See, even if it is supporting, it is more than enough. Macular degeneration, in macular degeneration, it improves the oxidative stress is reduced, and as it acts as an antioxidant and reduces the inflammation, acting as an anti-inflammatory, and the drusen accumulation also is reduced. So the antioxidants may slow the progression, as in AREDS study, but it will not reverse. Macular dystrophies, genetic mutations affecting the RPE, minimal effect is seen unless part of the broader integrative protocol study is done. In CRAO, CRVO cases, it is helpful. Blockage of the central retinal artery vein, it may help in very early stages if circulation is restored quickly. So the key factor is, once you know that your vision is blurring, or you're not able to see, or transient ischemic attack, they say TIA, transient ischemic attack. Or what does that mean? The eye, suddenly the light vision goes off for some time, it's not there, and again it comes back. So that's called TIA. And frequently, if that is coming, then you know that the brain, the blood vessels in the brain, the eye are not circulating properly. And if you're a person who has headache, and you're feeling tired, lethargic, if you're gasping, you're climbing stairs, you could be having microvascular changes in the heart, brain, eyes. So definitely there is a role for chelation or the wellness cocktail. So for more details, if you need to know about chelation, who can benefit out of this are people who are long-standing diabetics, cardiac patients, eye-related problems, brain fog, and other conditions. So these are typical good patients for chelation. But with the rider, we need to take a blood test to ensure that creatinine levels are good and the other parameters are taken care of. So we do it as an adjuvant therapy along with stem cell therapy, photobiomodulation, hyperbaric oxygen therapy, antioxidant rich diet and gut health support, and neurosensory and vision therapy as well. Along with it, meditation, pranayama, third eye yoga. So there are supporting evidences, as I told you. Lamas et al. In 2013 in the TACT trial said that chelation therapy lowered cardiovascular risk in diabetic patients. AREDS and AREDS2 trials suggested that antioxidant vitamins slowed AMD progression. So some case reports of DMSO used for ischemic optic neuropathy has pretty good results. So this is an amazing wellness cocktail. If you want to know more details about chelation for your near and dear ones who have eye problems, heart conditions, or brain fog, please reach out to us at the number given below. Dr. Sashi Eye Care, Swarnapuri, Salem. Thank you, Dr. Sashi.